I never thought I would cry over sperm, guys. Here I was crying to patients. Talk about investing in your patients, my goodness.
Welcome back to DocTalk, my favorite show where we talk to a doc about everything we know you want to talk to a doc about. Today's episode, we're exploring exciting new research out of the Turek Clinic. Dr. Paul Turek is a reproductive urologist who practices on the West Coast. He and his team, one of whom is here today, going to introduce her in a second, did a really interesting study on sperm production. They have exciting new research out of the Turek Clinic on a medication you may know by another name called Accutane. Molly helped me before we started. The clinical name for this is isotretinoin.
Yep, the generic is isotretinoin.
Yes, the generic is
and
isotretinoin.
You're giving away the spoiler.
I know.
Like a special guest star. Right?
This is Dr. Janet Choi. I'm Lissa Kline, and we are joined today by Molly Jessup. Molly is a nurse practitioner at the Turek Clinic. She's going to walk us through the research and what it could mean for couples navigating some of the male fertility challenges that we know are really tricky and can be really disruptive and expensive and disruptive. And so this study looked at using Accutane to sort of jumpstart sperm production in men with severe infertility. So welcome, Molly.
Thank you so much for having me. Thrilled to be here.
We're so excited to have you here and really excited to talk about this study. So thank you for taking time. So now that I know how to say it, isotretinoin, I'm going to say it as often as I can, also known as Accutane. I think most people know Accutane as the drug that some folks take in like post-puberty, adolescence, teen, for bad skin, right, for acne.
That's right.
And it is FDA approved for that. But here we're talking about it in a totally different context in sperm production. And so I'm really curious, how did you begin to think of isotretinoin within the context of male fertility?
Right. Yeah, great question. Why are we prescribing acne medication for creation of sperm?
Yes.
So really, this was actually the brainchild of Dr. John Amory. He's at the University of Washington Department of Medicine, and he actually published these two pilot studies on Accutane or isotretinoin. He's spent his life work trying to look into creation of a male contraceptive. And in looking at male contraceptives, he started to look at retinoic acid. Retinoic acid is the active ingredient in isotretinoin or Accutane. And so through his work with retinoic acid and looking at it for male contraceptives, he started to look at testis tissue and started to see that testis tissue that was associated with lower retinoic acid levels, those men actually were associated with lower levels of sperm in the ejaculate. And so he made the initial connection between, okay, retinoic acid, we know it's important for spermatogenesis or creation of sperm. Now let's see if we can flood their system, give systemic retinoic acid or isotretinoin to see whether or not that can help with the promotion or more production of sperm in the ejaculate. So he did these two pilot studies. Dr. Turek and I saw these studies and we said, wow, obviously, these were small population sizes. This is important information, though, because he had statistically significant results. And so that was 3 years ago that Dr. Turek and I saw these two studies that John Amory had published. And so since that time, Dr. Turek then and I have started to prescribe this medication for men.
That's fascinating. I know that you and Dr. Turek often see, really from around the world, some of the neediest or lowest prognosis. Yeah, the most complicated patients. I know they travel from all over to see you all. And so I really like the idea of these, first of all, out of the box, like creative thinking, but also less invasive ways of treating things that are, like I said, are really disruptive, like male infertility.
Exactly. I mean, that's a great point. I think, the big goal here for us is to see whether or not there's anything we can give guys who have been given no chance. So these are guys who are considered sterile, essentially. Nothing that is in the ejaculate. They have no sperm. And, the most common treatment for these men, if it's not a hormone optimization or, varicocele repair or anything else, if there's nothing else that is left on the table, typically they have to go through a very invasive procedure in order to acquire sperm. And so this was an idea, like you said, that's totally out of the box. That's a way for guys to actually potentially avoid procedures such that we get sperm into the ejaculate, and then they can use that sperm because it's typically low count still, such that they can actually go to IVF without ever having to go through a procedure.
I love that. So for those who may not be familiar with the terms, Molly, could you break down what is azoospermia? What is cryptozoospermia, which I made a joke has to do with Bitcoin, and everybody said wah wah. What do those mean, and why are they such challenges on sort of the way you were talking earlier? Why are they such challenges along the family building journey?
Yeah. Okay. So breaking down what these terms mean. So azoospermia, it means that in the ejaculate, when a guy goes for a semen analysis, there is absolutely no sperm found in that semen analysis. Now, when a semen analysis is done and there's no sperm found, what they will then do is actually pellet down the sample. So they will centrifuge that sample down into this very concentrated version of the semen.
Yeah.
You spin it down. Yeah. Exactly. Yeah. They spin it down, and then they're able to look at it in a very concentrated view. And so that's what, even by looking at the centrifugation, even looking at the pellet, there's still no sperm. Now, the difference between azoospermia and cryptozoospermia is when there's actually no sperm found in the neat sample. So before the pelleting or centrifugation of the sample, in the cryptozoospermic patients, there are a couple sperm found in that pelleted sample. So that's the difference. So 0, 0, 0 for azoospermia, and for cryptozoospermia, it's very small counts. Now, these are typically guys where, we have hopes with the cryptozoospermia guys. That means that there's production occurring potentially in the testes. It's just not enough to get out. And so we think maybe with azoospermia, that's the case as well for some guys, that there's still some sperm in the testicle, but because it's such small counts of sperm being produced, it's not actually getting out into the ejaculate.
Interesting. And when we were starting to talk before we started rolling, we were talking about Accutane being contraindicated for pregnancy. So meaning people who are trying to get pregnant or are pregnant should not take Accutane. Dr. Choi, you had looked up sort of what
just to double check. So when you look at the manufacturer's guidelines, so people oftentimes will take Accutane for bad cystic acne. It can be very effective, but you're not supposed to take it starting at least a month, if not longer, before you want to start actively trying to get pregnant, because unfortunately there's some associations with some pretty serious and concerning birth defects. So that's why for women who are on Accutane, you want to pause taking it at least 1 month before starting to try to conceive, and obviously not take it throughout the pregnancy. But I don't think the recommendations are the same for men who are on Accutane, right?
That's right. I mean, it's crazy to try and prescribe a medication that's so contraindicated for pregnancy in women. And yet here we are trying to promote pregnancy by prescribing it to men, right? I mean, it's like completely opposite. So, the good news here is that that teratogenicity or the effects for birth defects don't actually affect the male patient who is taking this medication. So they've actually tested saliva and ejaculate. They've tested semen to see what the concentration of isotretinoin or retinoic acid is in the saliva and in semen, and they couldn't find any retinoic acid or isotretinoin. So the effects actually don't affect men. Those birth defects don't affect men.
Actually, follow-up question. Did investigators test the level of retinoic acid in the sperm themselves?
That's a great question. I don't know, Dr. Choi.
Right. So curious. So more things to investigate, but this is an exciting
things to investigate. Great question.
All right, so I'd like you to walk us through the study. So can you tell us about the design and how you picked and chose the participants? And then we can kind of go through some of there are a myriad of other questions, but why don't we start with that one?
Yeah, great. So it was essentially a consecutive series. So we had guys, as you said, we see the worst of the worst patients, or the worst of the worst cases where guys have been given no chance. And so these are guys who we're seeing on a daily basis. And essentially we just, for the azospermic or cryptospermic individuals, one quick other note about cryptospermic individuals. Half the time, these guys may or may not have sperm in the ejaculate in those pelleted samples. And so half the time, these guys are actually considered azospermic. And so that's another note to just keep in mind. So when we're seeing these guys, we did offer them this medication. We said, look, this is a new medication, not FDA approved for this purpose, but there's some promising studies done by John Amory. We would like to offer this medication to you. And so then men either said yes or no. And then based on that, we would have consultations about the side effects associated with this medication. I'd have to talk to them about the birth defects and reassure them that it wouldn't affect them as long as they didn't hand over the pills to their wives. And then, so that was how we decided to, or how we got the patients into the study. So it was just a consecutive series of patients within our practice.
That's great. And then how was the isotretinoin administered, and for how long? And what was being monitored over the course of treatments, including, were there any reported side effects?
Yeah, so the medication comes as a capsule, and so we would prescribe a 20 milligram capsule that's taken twice daily. So once in the morning, and I always recommend with food and water, and once in the evening with food and water. And it was a consistent dose throughout the entire course of therapy. So and we would start them on the medication, or actually, prior to starting them on the medication, we did want to look at some baseline labs. Good. Because the medication, you just asked if there's side effects or any sort of adverse effects from the medication. There are potential adverse effects. So the biggest one that we all, if we know Accutane or anybody who took Accutane growing up, is the skin side effects. So it can cause pretty significant dryness of the skin. And so we'd have to talk about that and give recommendations on my favorite moisturizers and sunscreens and chapsticks and all of that, which I do have great recommendations if anybody's curious. The other thing that dermatologists who I spoke to when they prescribe this medication, they also typically tell patients to take fish oil supplements, which can help with the dryness of your skin. So there's that. And then any patient with a history of liver disease, it's contraindicated for them to take this medication. So I'd have to talk about that. And so that was also included in the baseline labs before starting the medication. I wanted to look at your comprehensive metabolic panel. So kidney and liver function. I would also look at cholesterol, because again, this medication is also known to potentially worsen cholesterol levels. So your LDL levels, your triglycerides. And I did see a slight increase in cholesterol levels when taking this medication. Not significantly in the liver enzymes, but more I did see men's cholesterol levels did increase while taking the medication. So prior to starting the medication, we would look at baseline labs. They would start on the medication. A month later, they would do repeat labs. So I could take a look at, testosterone levels. I would look at blood counts, liver enzymes, kidney function, cholesterol levels, just to make sure that I could see baseline to after a month of taking the medication to ensure things weren't, too significantly affected.
Yeah.
Did you have anyone drop out, or were they able to continue? And was it for 3 months or 6 months, or how long were they on it for?
Yeah, so after 3 months, so ideally they were on at least 1 to 2 rounds of spermatogenesis. So that is 3 to 6 months. So from today to 3 months from now, men have a whole new batch of sperm. So that's 1 round of spermatogenesis. Hence why in male fertility, we always talk about things in 3-month increments. So, so they would take the medication hopefully for 3 to 6 months. At the 3 and 6 month mark, we'd ask for them to get a semen analysis. And then if after 3 months we started to see sperm in the ejaculate, we would make the recommendation to, oh my goodness, alleluia, let's start having you freeze those samples to get it in the bank, because it's so exciting. And then again, after 6 months, we would make the same recommendation. So yeah, at least hopefully 6 months of therapy. And yes, you asked about any dropout. So we had one guy drop out, one patient drop out just before a 3 month mark because of the skin side effects. And he was an individual who worked outside, was constantly in the sun, had very severe skin sensitivity already to begin with. And so it just wasn't a great medication for him to start with.
And so then the most exciting result, which is why we're talking about this today, is the results show that 37% of the participants were able to produce motile. That means like not just lying there, but like swimming ejaculated sperm. So visible under the microscope, not just after being centrifuged, right? Like pre-centrifuge,
Spin.
Mostly.
Pre-spin?
So it was a lot of times it was still on the pelleted samples
Okay.
that we would see the motile sperm. However, there were quite a few where it was prior to the centrifugation or the pelleted sample that there was sperm.
That's
So this is unbelievable to have guys who had less than 2% chance to ever have ejaculated sperm. All of a sudden, we're seeing, a couple hundred in a sample, which is unbelievable. I never thought I would cry over sperm, guys. Here I was crying to patients. Talk about investing in your patients. My goodness.
And so just to be clear also, because you had said at the beginning that men with cryptozoospermia will occasionally have sperm and occasionally not. So how did you differentiate that at baseline, right, versus these men who are actually showing and manifesting some real change? Did you do repeat sperm analyses, and it was this way higher than what you normally see in cryptozoospermic men? Well, I can say that.
Yeah, that's a great question. So for the cryptozoospermic guys, we were very particular because we wanted to see repeat semen analyses to confirm that this was true, that this wasn't just going to be intermittent cryptozoospermia, that on occasion we would see it and on occasion we wouldn't. And so we would have repeat semen analyses for the responders such that we were able to see consecutive semen analyses showing sperm such, they were considered responders. So it was, so that's how we differentiated the responders for the cryptozoospermic patients.
Thanks for explaining that,
And the highest response was seen in men with a biopsy pattern called maturation arrest, which I thought was really interesting. What does maturation arrest mean, and why might these particular individuals have responded better to the isotretinoin?
Really good question,
Thank you.
Dr. Kline.
Yeah, great question. Okay, so this involved understanding.
Sorry, I was off camera.
We're going to get a graphic. I just know it.
That's so funny. So when thinking about these guys, typically a lot of these guys, these guys have been through a lot of procedures already. Mm-hmm. And so when they're coming to us and we're prescribing this medication, a lot of the time we actually know what biopsy pattern is within the testicle. So we know what we're working with. So there's a couple different types of biopsy patterns within the testicle. And you mentioned maturation arrest, but let's first start with Sertoli cell only. So Sertoli cell only, Dr. Turek always describes this as there's a house, but nobody's in it, which means that, right? That sounds like a Dr. Turek analogy, right? So what that means is there's these cells that exist, but there's no germ cells. There's no cells that potentially can become actual sperm cells. So no germ cells exist. It's just these Sertoli cell only cells. So that's one biopsy pattern. The second is split into two. So there's maturation arrest, which is either early maturation arrest or late maturation arrest. Essentially what that means is there are germ cells that potentially could eventually become sperm, true mature sperm. But with maturation arrest, for some reason, there's something that's halting or preventing those germ cells from becoming maturely formed sperm cells. So the early maturation arrest pattern means that they're stopping earlier in the phases to becoming a sperm. Late maturation arrest just means that they're a little bit more developed, but they're not quite a fully fledged sperm. So that's the difference between Sertoli cell only, maturation arrest, and the breakdown of maturation arrest early and late. And then, of course, there's spermatogenesis or true sperm being formed. Mm-hmm. And now what we found, you asked about the maturation arrest pattern, and our theory is that men with maturation arrest patterns actually respond better because there's this thought that perhaps the maturation arrest, so that these germ cells that are trying to become sperm, perhaps the reason they're not becoming sperm is because there's lower levels of retinoic acid within the testicles. Mm-hmm. And so our working theory is that maturation arrest patterns, if they require more retinoic acid, we can give it to them systemically, and then hopefully they'll see more sperm.
Fascinating.
It is really fascinating.
So
this is exciting, too.
It is, very.
Especially because I don't know, did you already highlight this? That 92% of the participants had unsuccessful prior testicular procedures to extract sperm, right? So this is like, basically at that point you're told, donor sperm or look at adoption, things like that. So this is another potential future option for some of these men, which is really exciting, especially the fact that it doesn't require procedure.
Yeah. So I'm curious go ahead, Molly, please.
Oh, I was just going to speak to that. I mean, these are guys who were told adoption only, et cetera, et cetera. And now actually as of last week, we have our second birth of a baby using isotretinoin ejaculated sperm, which is unbelievable. Two baby boys have been born using this medication. And we have another pregnancy ongoing right now. And so I'm like constantly checking in on these patients.
That's amazing.
That's fascinating and really good work. So applause to you, Dr. Turek, and everyone who worked on this. As we wrap up, I have one last question, actually two. How has this changed sort of how you all are seeing patients? I forgot to mention too when we started, Dr. Turek is in Network for Progeny, so Progeny members have access to him as a physician in our reproductive urology network, so could see Dr. Turek or anyone on his team. And so curious how it's changed sort of how you guys are practicing and offering options to your folks, and then what's most exciting for you as a clinician about the study.
Yeah. So I think it's an option now we offer to any patient who comes to us. Actually, we're getting a lot of patients who are coming to us asking about isotretinoin, and which is wonderful. I love that this is getting out there. Patients are interested. All of the patients that come to us are so well informed. My goodness, they do their homework, they do their research. So yes, we are offering isotretinoin as a program in our office still. And just so you're aware, it's just Dr. Turek and myself. We're the two providers that you will see when you come to the Turek Clinic. It's just us two.
Love that.
And so we are offering isotretinoin, and it's again, what a great alternative to try and see if we can get anything into the ejaculate before going to surgery.
Yeah.
Because that's always our goal, the least invasive as much as possible. And so I think that a lot of men appreciate that as an option, right?
Yeah. Totally.
And then you asked me a second question.
Yeah, that's okay. What excites you most personally as a clinician treating these patients about this study?
Gosh, well, I already said it. I get way too invested in my patients.
I love that.
I just
said that already.
Yes, Dr. Choi just said you cry about sperm.
I cry about sperm, guys. That's a little embarrassing. You don't tell a lot of people that. I feel like it's okay to tell you
babies,
guys.
And we're all about building families, and so that's.
I like that we talked about least invasive, so I like that. Mm-hmm. Obviously, there are side effects, right? But least invasive, it's also, I assume, much less expensive than a surgery, right? And so I like all of that about it. And like I said in the beginning, just the out-of-the-box thinking about what tools do you have in your toolbox to treat this population of people to achieve their goals, I just think is fantastic.
Yeah, I completely agree with you. That's why we're doing this, and we're going to continue to do this. Of course, we still need more data on this medication. Yeah. This is so preliminary. And so I think the more that we talk about this, the more we offer it, the more we see results. Hopefully we'll get more people involved so that we can have more data on the medication.
Fascinating. Well, thank you so much for joining DocTalk. You're welcome anytime. I know you're on the West Coast, but you're also welcome to come to New York. It was a lot of fun talking to you and learning about this study. So thank you
so much. I've had a blast
having you on the show.
Yes. Right? So could Accutane really jumpstart sperm production? The answer seems to be yes. Early research, early studies, at least for some men and those suffering, as we talked about, from really severe infertility. So as Molly said, findings at the Turek Clinic suggest that an acne drug, isotretinoin or Accutane, could someday offer new hope for couples navigating fertility, and I think it already is offering that hope to a lot of people today. We're very excited to see where the research goes. Really happy to be partnering with the Turek Clinic and the treatment and care they provide to progeny members and to everybody. And so, like I said, a big thank you to Molly for breaking down the science and helping us understand sort of what the study was and what the outcomes were, and really helping, I think, to illuminate some new ideas in the future of infertility care, especially where men are involved. And as always, I like doc talking with you.
I love doc talking with you Wednesday. Lissa, yeah.
They're calling me Wednesday because of my dress. We love doc talking for you. Please let us know any topics you'd like to hear us doc talk about. As always, have a great day. Bye.